Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a nice example of pancreatic solid pseudopapillary neoplasm, but presenting in an adolescent male patient. So this is a 13-year-old male patient who presented with persistent abdominal pain and vomiting. So underwent CT of the abdomen and was found to have cystic mass in the head of the pancreas. And the differential diagnosis was wild, but including a solid pseudocystic tumor. So this is the true cut biopsy, and this is a low power magnification. And as you can see, there are fibrovascular cores lined by really very much monotonous cells with acidophilic cytoplasm, giving an overall acidophilic appearance to the tumor. And as you can see, there is edema around the vessels within the fibrovascular core. Other areas were more or less solid, but again composed of the same monotonous cells. And on high power magnification, the tumor cells are very much monotonous. Each one really resembles the other cell. There is some vacuolation in the cytoplasm of the tumor cells, not much in the way of pleomorphism nor mitotic activity. So this would really bring into the differential diagnosis a number of entities, including the solid pseudopapillary neoplasm of the pancreas, as well as neuroendocrine tumors. These are among the top differential diagnoses. There were areas of necrosis identified in the core, probably related to the size of the mass. And the first and most important immunohistochemical stain to perform is beta-catenin. And as you can see, and as I alluded to before in one of my videos, you have to look for a nuclear staining in the tumor cells. And this is beautiful. This is one of the solid areas, beautiful, sharp, clear nuclear staining in the tumor cells versus the negative nuclei in the surrounding or associated vessels. And it's always important to make sure that your immunohistochemistry is working properly, especially when you have like widespread immunostaining, to ensure that this is not false positive. So we have to look for the internal negative control. And then in beta-catenin, remember, you have always to evaluate the nuclei, not the membrane or the cytoplasm. And this is in the papillary areas. Again, negative internal control, positive tumor cells, staining of the nuclei of the tumor cells, which would be consistent with a mutant phenotype. It's extremely important, this immunohistochemical stain. If you don't have but one stain to perform, beta-catenin is your stain. And then we have the staining for the PR in the tumor cells. And this is why some pathologists advocate that there is a predominance of this type of tumor of females because of its association with PR receptors in the tumor cells. And again, the third immunostain is cyclin D1, as cyclin D1 is positive in the vast majority of the tumor cells. So this is the trio, actually: cyclin D1, PR, and most importantly, beta-catenin to render the diagnosis. Now, cytokeratin is important to perform in order to rule out a neuroendocrine tumor, because sometimes, as in this case, some tumor cells might be positive for synaptophysin. So you have to confirm your staining, the presence or absence of a neuroendocrine phenotype by other immunohistochemical neuroendocrine marker, and in this case, the chromogranin. So remember, synaptophysin can be positive in the tumor cells of this tumor, but chromogranin is negative. Cytokeratin sometimes can be positive, but in this example, in this particular example, it's completely negative. So the final diagnosis was pancreatic solid pseudopapillary neoplasm. Remember that this tumor predominates in females, but it can also occur in males. It usually occurs in slightly older age groups in young adult females, but in this example, it occurred in an adolescent male. And the most common location of the tumor is the tail of the pancreas rather than the head of the pancreas. Remember that your best immunohistochemical stain to perform, if you have the chance to do one stain, is beta-catenin, and you should be looking for a nuclear stain, not cytoplasmic or membranous. I hope you find this tip useful in your daily practice. Thank you.